Overactive thyroid. If you have Graves' disease or if you think you have Graves' disease, here are some considerations, particularly if you're tired of managing the Graves' disease with the prescriptive hormone blocker. And what if I told you there was another pathway? At the West Clinic, we've been treating Graves' disease for over 40 years with an approach that goes beyond the typical prescriptions. So we believe that chronic infections can be a trigger to your immune system or a toxicity or another barrier to healing that results in a hormone system that isn't working right. If you're looking for a natural integrative approach that most doctors don't even know about, you're in the right place. So let's dive into the treatments that are giving people their lives back. I'm Dr. Jason West in the West Clinic, and today we're talking about Graves' disease. If you or someone you love is struggling with this, I want you to know that there's hope. Most doctors treat Graves' disease by blocking hormones with medications like methimazole or PTU. But what we do inside the office, we think that there's a really important consideration and maybe even a better way by finding and fixing the root cause. So what's Graves' disease? Well, it's an autoimmune condition, which means your immune system gets confused and starts attacking your thyroid. That's the gland in your neck right here that helps control energy and metabolism. And this leads to an overactive or hyperthyroid. And where your body speeds up too much, making you feel anxious, shaky, or even causing your heart to race. So Graves' disease starts when, again, there's that trick in the immune system that goes haywire and it mistakenly attacks your thyroid. Now, what I think is the trick is we get some type of infection that gets stuck in the thyroid because the blood circulates so frequently through the thyroid that what happens is that gets stuck, and then the body has an overreactive immune response and it makes the thyroid create too much hormone. I mean, literally, it's this hiding place that causes this dysfunction. The good news is there's some really important considerations where you don't really have to live that way if we get your physiology and metabolism fixed. So traditional doctors often prescribe the hormone blockers to slow down your thyroid, but that doesn't ever fix what's happening with your immune system. We do things a little bit different. We focus on why your immune system is wonky and then how to help that and giving the nutritional support not only to the thyroid, but to the pituitary gland, the hypothalamus, the adrenal glands, and we want to see if there's something that's blocking the barrier to healing. Once we know what's caused the problem through some additional blood tests, some environmental tests, some hormone tests, even a mold test, a heavy metals test, we're looking for anything that's causing, again, the body not to be able to get back together. So here's how we help that. There is an advanced nutritional therapy called protomorphogen therapy that, in my experience, helps calm your immune system and protect your thyroid from further damage. Then we have these signaling molecules, these oral peptide therapy that literally it's like knocking on the door opens so that the nutrients go inside of the organ system, and these tiny proteins help by re-educating the gland and helping your immune system to be the right way. Then we want to get rid of the nerve memory. Sometimes what happens is when you have an organ system that doesn't work for a long time, what happens is the nervous system thinks that it's normal and it recalibrates. What if there was a way to get your thyroid to literally shut off and then open up and recalibrate? We call that neural therapy, and there's some advanced nutritional things that help to decrease the inflammation and get your immune system to work. Now, how does it work? I won't lie, it takes some time. Healing naturally involves making changes to your diet, your lifestyle, and working with the right clinical treatment. But here's the great part. We've seen excellent results for nearly 40 years. Our patients experience improved energy, their brain works better, their metabolism is better, and they have a healthier thyroid without having to rely on a lifetime of prescriptive medication. Now, if you're ready to explore the non-prescriptive and advanced protomorphogen and nervous system reset for Graves' disease, go over to www.bestmedicaloptions and fill out our free complimentary visit form. Then our team can personally reach out to you and help you take that first step towards feeling better. Graves' disease doesn't have to control your life. Let's find the cause, remove the barriers, get nutrition in the system, recalibrate, and help you to not live here, but live up here. I'm Dr. Jason West, and I'll see you on the next educational video. Thanks for watching the video. If you'd like more information, education, or want to work with us, head over to bestmedicaloptions.com. And if you want to help to reach, teach, and heal the world, leave a comment, like, share it with someone that you love. It may seem like an impossible task, but those that are crazy enough to think that they can change the world are the ones who do.